today we have a very interesting topic for our Solutions for Aesthetics Roundtable discussion, and we're going to be discussing going deeper with your client. Today's clients are not looking at serious clients, are looking for something more in-depth from their clinic, and they want to invest serious money with us. But in order to achieve that, they are looking for knowledgeable, educated people that are professional, that have a high level of ethics, that have intelligence, that have authenticity, and also that they're very, very caring in connecting with the specifics that the client wants and being able to deliver that, but also looking at the navigating around the commercial side without appearing that they're being pushed just to buy. So there is a complexity of skill sets that are required. And we have two beautiful experts today that are joining us to share their experiences and how they're navigating that situation. Melissa Pritchard and Rose Bonaceres, we are delighted to have you today. So let's get started with Melissa, with your question. Key principles for developing a personalized client education plan and improving communication strategies to create value. So the whole thing is about engagement and what causes improvement in the connection, where the value is transmitted and the consumer resonates with that. And so they become an ongoing client that you have a history with, and you can take them on a journey based on the integrity and the realization that they feel you are the right person for them. So how do you go about that?
So, gone are the days where we go in and we book in for a skin needling and we get a tick and flick form and we go in and we have our service and go again. That doesn't happen these days. We're health professionals, and so we perform proper consultation. And so all of this starts at the consult. And it's not about just determining contraindications, it's really getting to know a person. So it's about having active listening, asking questions that are appropriate, and you're going to get the information that you need. I was at a conference recently and they talked about the TED method, where you're just like, tell me more, tell me about this, explain to me, and describe how. And you can get so much information from somebody by using that. And my sister, my business partner, my sister, she has a really funny saying, and she says, "We have two ears and one mouth, and we should use them in that ratio." And so we should be listening more, listening to what they're saying, really actively listening to get to the root of what the problem is. Because sometimes, even though they come in and you look at their skin and like, "Yep, you have acne," the acne might not be the problem so much. It might just, their goal might be that they want to be confident going out and being makeup free. And that, so their goal might not be to have no pimples. Their goal might be to feel confident in their skin, even if they have a few breakouts, to go out with minimal makeup and be themselves. And so you have to really understand what their driver is there.
That can I just
Yeah.
pause you there and say
Yeah.
that is so true, because the problem with our industry, sometimes a practitioner goes in with her own agenda, that she's got this new machine, she's going to convince them to have laser. So it's all about her and what she's going to do, and they fail to connect. And I find that very ambitious salespeople often totally miss who the heck you are, and you think that's just not me. Well, I don't know what you're rattling on about, but you're not going to convince me. So really, the shift in recent years, especially since COVID, is we need to really step back and know the person more fully that is in front of us, that we, and what is important to them. That is the one of the biggest shifts that's happening in being able to develop a deep relationship with that person where they feel you understand them.
Yeah. And so
Mm,
that's like it's the individualization of it. And so
mm,
it's, yeah, I have seen that in the past. We're like, yeah, we've got this special on micros, and they'll bring them in and they'll be like, yeah, our goal is to sell six skin needling or six micros. That's how, and that's not how it really should be. It's about not only what individualization for their skin treatments, but it can also be for their lifestyle. Do they work in the sun all the time? Are they a mum? Are they a presenter? Do they have to speak on stage really regularly? You have to individualize it for that. But also their budget. People forget about this part. And so
Mm,
in my consults, one of the questions I pretty much always ask is, do you have a budget for this? Like, what is your budget? Or have you thought about it? And so,
mhm.
if I'm not going to go in and be like, yeah, well, let's do this $7,000 package and they can afford $50 a week. And
Mhm.
so sometimes it is about having this open discussion around what they can afford, what they can do, and what is actually realistic for this person that's sitting in front of you. And
Mhm.
so you can be like, yeah, like I see that you have $50. But if you then go in and explain why you're recommending something that's more, so instead of just being like, this is the best, but being like, I really think you need to do these prep peels, and then we'll go in and we'll do two skin needling, and then I'd like to go in and do some plasma. And you explain every step of the way why that is important to their goal, not why it's what it does, but why that is going to help them and how that is going to help them achieve the goal. They may be like, oh, okay, well, like I want to do that. And then it's actually about informed consent. I learned more about this in nursing than I did in aesthetics, but about informed consent and just giving them the information and allowing them to make a decision is shared decision making. And like, this is what I'm proposing to you. How does it sound for you? And they
That's
can
a
come
good
back and we work
statement. How
together.
does it sound to you? How does that sound and pause? I think
Yeah.
that's a very, very important. In sales, that is the key thing. Stop getting all worked up and see how it's communicating. Yeah, yeah,
So
that's
every
very good.
day, yeah, I don't feel like I sell anything ever, is what I don't think, and I also don't love KP. I don't like KPIs are big in our industry, and I get that. I sometimes feel like putting a number around, especially around products, can be a little tricky. But I believe in providing a whole service to people.
Mm,
And I can't do my job without recommending their products that they need to use to support at home, planning with them what their next treatment is going to be, and really looking after them as a person. And that could mean holistically. So, do I need to refer them to a naturopath? Do I need to send them? Have we tried enough? And is it time to send them to a dermatologist?
mm,
It's also about looking after a person and being honest and ethical around it. And
mm,
I can honestly say that in some situations, I've sat there and been like, your expectations for what you want me to achieve are not realistic. And you will spend your money 10 times with me trying to achieve this facelift.
mm.
I honestly think you should save your money and go and have the facelift because I don't know that I can't guarantee that we're going to get that result for you. Because they walked in and they went, I want everything lifted.
Mhm,
And I'm like, I could try and we can try,
mm.
but you may spend your money tenfold trying to chase that.
Now that shows that you know your craft and you know the limitations, and you're quite prepared to be honest and make sure that the investment that they have with you, it can deliver the results that you want. And I think honesty is a very strong component. What we're seeing is that the consumer now wants a more mature approach that is putting them at the center of your decision
Yeah,
rather than coming with an agenda yourself.
absolutely. And so I believe everyone should charge for their consultations. We're health professionals. We've all gone to school for a long time, and um, so I charge for my consult, and which means I have no expectation when anyone walks in my door that they have to buy something from me because I sit there and I'll be like, I've charged appropriately for my time. And you have my time, and so I will give you my advice. And whether you take it or leave it or come with me or do, it's just a matter of this is what my recommendations are, and this is how we can work together. But sometimes it's I'm not the right person now. And so sometimes I will look at somebody and they are stressed, so stressed. They have all the gut issues. They have so much going on with their life. They're like their stomach is so upset and I can see it on their skin. And I was like, I think actually now, if we only have this small budget, maybe see the naturopath first.
Mm.
and then come back to me. Once you've got that sorted, come back to me then. And you would be surprised how many of them they come back because I am honest and I'm open and they like this person cares about me because I do. I care about all of them. And so they sometimes it's not about what I can do, but sometimes like I have the tools and the knowledge to know where to send you when it's needed.
Mhm.
And they really, really appreciate that.
Yeah,
And so
you're very
yeah,
clear about your confidence, and I think confidence in what you do and how you advise is something that resonates. If you're too questioning and too vague, and what do you think? And it's I maybe we could suggest that it looks too vague, and so why would I invest heavy money on something when I think you're just experimenting with me?
and while I do believe, like, it is always in consultation and it is always directed with the person, it's shared decision making. But I do also preach that we have to be a little bit in the driver's seat. Um, we are the ones that actually have to decide if it's appropriate, and guide our clients in a way that they should be. But that has to be ethical. It
Absolutely.
has to come from the right place of really wanting the best. And if you're looking at every person as I want to provide a whole service and what can I do to solve this problem, it's not sales. It's problem solving, which is it's what we're here to do. And so but it has to be ethical.
Hmm.
It has to come from the right place. And if you are looking at it as problem solving from an ethical place, they will trust you and they will feel it. And then that gives you the opportunity to guide them in the way that's best for them instead of being like, oh, would you like to maybe do skin needling? Or maybe we could do RF, or maybe we could do a peel. That's they're going to feel that and they're not going to trust that you know what you're doing. So it's that very fine line between this is what we need to do. Let's work together on how we can get there and working with them with budget. And there are compromises. And if they can't, like, if they have a smaller budget or they can't come as frequently, you just have the honest conversation around, well, yes, we can do that. That's not a problem. But instead of seeing your results in 3 months, it may be 12.
Hmm.
Are you okay to accept that?
Hmm.
And then is then their choice. And you've given them all of the information and they can make an informed decision around their care and their health care and their skincare.
Okay, Rose, I want to ask you, how do you resonate with that in terms of direction that Melissa's talking about, taking the initiative? How do you balance having heard the client and having the confidence to give the right direction for the treatment? How do you view that?
Well, I think integrity is everything. As a practitioner, we have to have integrity and we have a duty of care to that client to be able to provide information. I would much rather have an educational conversation with someone than a retail conversation,
Yes.
and
Mhm.
people seek to be understood and seek to be heard, right? So we need to really engage with them, build a relationship, and create trust and rapport in that consultation. It's really important that we do that. And you need to find out what their real concern is. At the end of the day, they have come to us for a solution.
Mm.
And educating them in the why they're seeing what they're seeing and how we can support them get to their end goals. And sometimes that may be a collaborative approach with other practitioners. Sometimes it's not, but we can always help someone in some way.
Mm.
Um, but it is about having the integrity. It is about providing education. It's getting to their why, giving them the right information on how to get from one place to another, and giving them the bigger picture. I think that's really important. It is not about selling. It is part of our job, but there's so much fear still out there with regard to actually recommending products. We need to provide products to clients to support what we're doing in clinic. End of story. It's part of our job. But there's ways of going
Mm.
around doing
Mm.
that.
Well,
It
the
is
thing,
through education, about having an educational platform.
that's right. Well, the difference between a practitioner and a counter consultant, where they just there to tell you about a product, is the practitioner is required to engage and really understand. It's a totally different approach. But
Yeah.
your question is, how do you effective educational approach that doesn't appear, salesy. In other words, how we need product, we still need to sell, we still need to meet targets, but we have to do it with the objective of solving a problem. So, for example, if you're recommending at the end of a treatment a product, how would you position that to the client so she felt that it really was for her and you weren't just moving something on your shelf?
Well, it actually starts before they even enter the clinic, because people are savvy these days, right? They're going to do their own research even before they come and visit you. So if you have an educational platform within your business that is already providing education to clients, whether that be Instagram, you could be doing reels, it's storytelling on social media, you could have email direct marketing. You could be doing podcasts, all those things provide fundamental education and help to build rapport and trust before that client actually walks in the door, right? Then they join your database, they're continuing to get more education. Then when you get them in the room, that trust is already kind of there. So when you're talking to them about their concerns, what they need support wise when it comes to skincare and home care, they're going to trust you, they're going to believe you, and you're giving them a solution as to what they're wanting to achieve and what their why is. It's not about having a retail conversation at the end of the appointment. Okay, this is what you need to buy. It's kind of a little bit too late by then. You have to think ahead, paint the bigger picture, create as much educational content as you can to create a reputation about who you are as a practitioner. So when they come in and have a consultation, you're able to provide them that underpinning knowledge, the education. We are of service to this person, so we want a long-term strategy, and it is about consistency.
Yeah, so basically what you're saying is that the brand has to define who they are before the client comes in. So there's an immediate respect of the client to be willing to listen to you. You're not trying to sell your integrity. You've got to actually communicate that so that people know that they can trust you.
Absolutely.
The other thing that I was going to ask you is, what are your thoughts on presenting a product based on the specific ingredient that will solve a specific problem? So, for example,
Well,
yeah.
that is a good question, because it's up to us. We need to know that, right? We need to know the ins and outs of everything that we are recommending. But you will get clients that want to know that information. And then you will get clients that say, just give it to me, I'll buy it. And
Right.
they don't want to know that technical stuff, right? But there are some clients that do. So, yes, we need to provide that information, but I'm not going to recommend a product because it's got niacinamide. I'm going to recommend the product because it is going to support the skin in this way. And if they want to know more information, then I'll provide that. But it's not my first point of education, you know? They want to know what it's going to do for them and how it's going to support them long term in the solution that we're trying to achieve. So I'm always painting the bigger picture.
Right.
Can I add something into that? I do a little bit of that, of like the product, the ingredient knowledge, because I have a few different lines within my clinic. And so some of my lines are very high end. They're very high end, and some are a little more affordable than the other. All very good quality. But I can be like, here, this is the vitamin C that is $300. Oh, okay, no, that's not. So this one is vitamin C, but it's only two. And so it is, and they have tyrosinase inhibitors, and like, and if you're talking about this ingredient works on this problem, we can swap between brands if needed, instead of just by picking up because this is a brightening serum. And so if you're going by ingredient, like you need vitamin C, you need ceramides, you need this for barrier function, you need this. When you go to your front counter, it's not that you just need this serum, and if it's outside their budget, there's nothing else for them. If you're talking ingredient wise, you do have the flexibility. If things don't quite go as planned at the checkout, then you can go, it's okay. This other one also has ceramides in it. Let's go that one instead.
Right.
And so I do a lot of more ingredients than I do like just product. if that makes
Yeah, I
sense.
think if you're
Not tweak
aligning
the
the
ingredient.
ingredient, if you're aligning the ingredient to their deficiency, say, let's just say they've got dehydration, and you say, well, this is your problem, that we need to step up your hydration levels. We've got different types of hyaluronic acid. This one has the right molecular structure to sort out your problem. Then you're educating them in the product is about solving your bring a solution to your problem, rather than just, then that way they get away. It's not just about the brand. Yeah, that is a good strategy, and I found that that's also very, very useful. I want to ask you both, because Julian unfortunately had an urgent issue that he wasn't able to attend, and his question was effective meet, greet, and follow-up strategy. So when you ladies, when you have a therapist greet a client, do you have a protocol how they are to do that? Because, or do you allow them to just call them by name? Do you have policies about you call somebody by their surname or their first name? What are your thoughts on that?
Do you want to go, Rose, or do you
Oh, I
Greet.
don't mind. Yeah.
don't mind?
I guess in our clinic, obviously helping them to feel welcome is really important because it can be very intimidating walking into a clinic environment, right? So especially for the first time until they get to know us. So it is about greeting them, it's welcoming them, providing them a cup of tea while they fill in their consent form. We do offer that service online, but if they haven't done it online, it gives them a chance to do it in the clinic and get a feel for the place. And then it's obviously taking them through into the consultation room and having a nice chat with them. So it is about making them feel very welcome and not feeling intimidated. And I think that's really important when it comes to greeting them. Eye contact, very important. Welcoming them, saying hello, and just making them feel comfortable. It's really not that hard. It's
They're
it's
asking
simple.
their
That's
name.
all it is.
What about asking their name? Like say, hello, Mary, I'm Jane.
Oh, of course.
Yeah.
Yeah. Always greet them by their name.
I
Yes.
have,
It's just a habit. Yeah.
I have to tell you a really interesting incident that I had in Canada. When I used to travel, I'd always visit, award-winning places and all that to get ideas. And I'll never forget one that really impressed me was that the therapist came up to me and said, "Hello, Mrs. Viney, is it okay for me to call you Tina?" She asked my permission to,
Oh,
and I thought that was, it made me feel so special. I thought that was, is it okay for me to call you Tina? So she got my permission. Now, Canada is a more formal country and maybe a little over the top for Australia, but it depends on, I think if you have a woman of status and you ask that permission, I think it's a lovely etiquette touch. But it really resonated. I sat there and I thought, oh, wow, that was so lovely of her. So,
It's the little things, isn't it? Because this is a big deal for a client making the choice to actually come into a clinic and, really find some help. So they're already nervous, they're already anxious. And I think just making them feel, yes, special, like you said, but comfortable in an environment is really good to let their walls down. That's part of the process. Yeah.
and also, I think consultants sometimes, when they don't know your name, they just call you darling or sweetheart or whatever, which is fine if you know someone. But I think it's very condescending for someone that doesn't know me to call me darling. I'm,
Oh, yeah.
I'm sorry,
Yeah.
I'm not your darling. So I
Or
think,
love.
or love. Oh, yeah.
Love.
Or love. So, okay, follow-up strategies. Okay, when someone's had a treatment, Melissa, do you ensure that someone follows up and gives them a phone call to check on how you
every
do
day.
that?
Yeah.
Mhm.
So we have a really strict follow-up policy. And so if they have had like a service, like if we've done anything really, we will follow up with them the next day or like the following business day. So when they leave, we will text you or call you tomorrow. So generally the higher the risk, we'll call. Um,
Correct.
but if it was something that they've maybe had before or not as high risk, we might just say, or we ask them, would you prefer to be called or text tomorrow?
Oh, that's good.
It's because some people are like, oh, I can't answer my phone. I'm at work. And I'm like, oh, is it okay for me to just text you? And we will just text and most of our clients like text. So we will just text and say, hey, like, how's everything going? Please make sure you reach out to me if you have any questions. And so it just opens that door that if something did kind of, God forbid, if something did go wrong, that it opens the door that they could be like, I'm not sure. I'm not sure how that went yesterday, and it just means like I care, I really care about your outcome. I'm looking forward to seeing you again soon. But it gives them the opening to come back if there is a problem instead of being like, well, my face feels really bad. I'm just not going back.
Okay, and the other thing too is if you've had laser or something like that, that there could be a reaction. I think pursuing them and saying, "Is everything okay? Is it feeling too hot?" Just to determine whether, there are reactions happening and whether you should see them back again.
And then it's very easy to troubleshoot in the short term before it's gone really far. I could be like, come back in and we're going to do an LED. Whereas come back in, come in, have a complimentary LED. I just want to lay eyes on your skin today. I'm not sure that this is normal. Let's do this. Or come in for a review. Or what did you put on your skin last night? How did that go? And maybe stop that for a few days and then touch base, and then making sure that we touch base again in a few days and just make sure that things are okay.
Mm.
And so that
I
follow.
think letting clients know of the aftercare protocol is important. So having an aftercare protocol system in place is very important. And we follow up with email and just, touching base with the clients just to ensure that everything is okay and reaffirming that aftercare, because I think that's important because their expectations with regard to their skin, they need to be aware of with some treatment.
I totally agree with that. I know with court cases that we deal with as an expert witness, that I've got to do reports and I've got to examine the how the incident occurred, and looking at the post-treatment instructions. Most of them are totally inadequate. Like, for example, you've had laser, you've activated heat into the body that's supposed to regenerate. So you're going to feel a bit uncomfortable. You're not allowed to scratch, because if you
Yeah.
scratch, you're going to create a reaction. You've got to stay away from the sun. You've got to wear loose clothes. If you've had laser for hair removal, for example, nothing tight jeans or synthetic fabrics. Wear something loose. Go home. Take it easy. Don't eat very high spicy food. If you're going to have a shower, make sure that it is not hot or too warm, because it might increase the heat in the body. Giving them the other thing that we are finding in our protocols that we suggest is give them the exact product that they need to use. Don't leave it up to them, because after a heat-based treatment, you don't want something that's going to occlude the skin and keep the
Yeah.
heat in. You want to have the right a breathable ingredient that can soothe, calm, heal, but allow the heat to come through. So I think using the recommended product straight after a heat-based therapy is very, very, very important as part of risk management. But really,
Absolutely.
the majority of the court cases, the slips are little things. They forgot to tell them this. Oh, it feels a bit hot. Put a cold compress. If you're not feeling well, or if it feels a bit too hot, please ring us. And we also recommend that every clinic should have their own doctor that they refer to that understands the treatment. They can immediately send to them if they feel that they need some antibiotics, rather than allowing the patient or the client to go wandering around and target any doctor in the area that hasn't got a clue what you're doing, and can immediately criticize what you've done based on
Yes.
reaction when it wasn't your fault. It was maybe something that they've omitted to do. But I think your client is your responsibility when she goes home as well. And I love what you guys are saying, because you are taking total responsibility for their well-being, not just take their money and then on to the next client. You are looking at how is the treatment processing and how is the body receiving it, because we don't really know what stress levels are in action that could trigger a reaction or adverse effect. And really, we also need to encourage them to take it easy. So if they go home and have a fight with their husband and get upset and grab a glass of wine or something, they could activate a reaction. Now, that's not your fault. So I think teaching them to respect their body and to contribute to the aftercare instructions by abiding them is so important. Yeah. Okay. Any other things you guys want to mention? Then let's go to Dee's question. Now, Dee, unfortunately, as we know, she's had a little baby and both of them have got the flu, so they're not very well, but she was very, very, very keen to contribute. So she's given me an answer which I'd like us to explore. And her question was, key communication principles for building trust, respect, and importance of honesty and authenticity in your scope of practice. One thing I know about Dee, she always was about scope of practice. She felt that sometimes we can make mistakes if we're a bit too ambitious and we move into an area that's not really area that we are qualified in. So she has an interesting story, which I'll read at the end, but just going through what she said, the 3 key communication principles that align closely with my values is that, and one is clear communication, active listening, and non-verbal communication. So she defines that provide clear information means using clinical yet simple terminology that is educational, transparent, and relevant to the client's individual focus, rather than using language that you can be perceived as misleading or unnecessary or in order to sell a treatment. I believe that clients should be informed but not pressurized. And I think, again, it's not about it's more about what is the angle, what's your ethos in your communication. Then she says, provide clear information, meaning using clinical yet simple terminology that is educationally transparent and relevant to the client's individual focus. Rather than, I think I read that one. Active listening. So she refers to active, it involves genuinely taking in what the client is communicating throughout the consultation or appointment, identifying their true concerns and goals, and then responding with realistic, honest feedback, as this means being able to clearly summarize and reflect back to the client what they have expressed, ensuring that they feel heard and understood. So what you guys were saying before is that if you know exactly what is her pain point, what she really wants, then you put a plan in place, and then you reiterate that the plan is aiming to solve that problem. So she's saying, the communication needs to be reinforcing what the client said. Okay, the other one that she says is about the photography. Non-verbal aspect of communication should be reinforcing transparency, trust. This includes providing realistic before and after images, as well as detailing a written transparent plan outlining costs, expectations, and recommended timelines from the very, very beginning. So together, then, the principle helps foster strong relationships and our client built with mutual respect and trust. So interestingly, she says something that you guys have mentioned, they have to know what the costs are going to be and how the plan is going to work for them. And what do you think about the before and after photo? Do you guys do scanning and show that? Did you find that's useful?
Yeah,
I
definitely.
do. Yeah.
Because really, sometimes the transition is very slow, and you think I still look like me, and then you look at no, you don't. Look, that wrinkle's not there anymore, or there's definitely an improvement in, what the concern was. So, what systems are you using? Are you using uh, Visage or
We have a observe. So we have the
Observe? Yeah.
observe, and we use that at their first appointment and then periodically throughout their journey with us. We also do take actual photos as well. So
Mhm.
for their file, because sometimes things will look good in life and then you put them under the observe and you're like, what? I mean, like it's so much better. And so sometimes having both, where you can really have a look at both and see what's going on. Because if you've been working with someone for 6 to 12 months, and sometimes we work with people for a long time, they forget where they started. They forget how bad their skin actually was. And so
Mhm.
then you can just be like, okay, let's put them together and have a look and make sure we are on the right track. Or if it's not, maybe we need to increase it, or maybe we need to move products, or maybe we need to do something. It gives you, it's a tool for information, really.
Mhm.
Yeah, I think anything visual is good. We do take photos and we've got the visual diagnostic with the Observe as well, which I'm about to upgrade. But I also encourage my clients to take their own photos. I always tell them, take your own photos on your phone because you're not going to forget what you look like and you can keep track and that keeps you motivated. When they look back on their photos and they think, Rose, look at this photo, and they show me their phone and say, look at this photo that I took today in comparison to when we first started. And they get excited themselves. So
Mhm.
I think it's a good strategy for them to do it themselves as well as also us in the clinic. Yeah.
Okay, well, I think that they're very, very important issues. Sometimes people think, why invest in these machines? But if they help to clarify and provide, because really we're not doing surgery where the results are, dramatic. We transition and it's like the frog in the water when it's slow, slow, slow. You don't realize that things are changing. And I think showing them the improvement of their journey back in the older days when they had consultation forms that were paper, they would have a face and then you'd put where the marks were, the areas that you wanted to correct. But I think the new technology is a lot more powerful. There's AI now with uh, the scanners. So
I
that's
think
Yeah.
interesting.
skinners also allow, because we know what we're looking at. I mean, we probably don't necessarily always need a skin analysis machine to know what we're doing. Like, let's be real about it. But sometimes it is really nice to sit with a client and go, do you see this? Like, you see this redness here? This is water loss. You see these downward lines? This is collagen loss. Like this, you see the bacteria? We need to work on this. And so having them being able to, because all they come in and go, I don't know, I don't like the way my skin looks.
Mhm.
And you just like, this is what the problem is. And having to being able to sit with them and be like, we can fix that if we do these things. If we
Mhm.
do the products that are going to work on this bacteria, if we do the hydration that's going to work on the redness, we do all of these things. And they're like, oh, yeah, I see. And then you can put another one later and be like, see, the bacteria's gone. How great's that? Our LEDs are working.
What about identifying pigmentation that's under the skin that hasn't quite manifest? That's a powerful one, too, isn't
Yeah.
it?
Very good, that one. Yeah. Because
That
it's things
tricky
that they can't visually see. Yep.
Can't be just hasn't come out yet.
or
So,
that tricky melasma on about the Fitzpatrick threes
mhm.
that doesn't present, like, it looks like sun damage sometimes. And then you're like, hang on. Like there's just a few little specks that are now showing on the surface, but it's actually melasma. And I'm like, I've picked that a few times where I'm like, we're actually going to treat that a little differently now.
Yeah. Well, that's good. Okay, so we keep going. She says, as our industry continues to evolve and technology rapidly advances, I believe there's an increase in need for practitioners to continue to reflect on their scope of practice while innovating creative and exciting opportunities. We also have the responsibility to maintain ethical, prioritize client well-being, and avoid becoming the sole drivers that only target sales and KPIs. Okay, so she gives a wonderful story where somebody came to see her and she apparently had some kind of milia looking problem that other people had tried to extract unsuccessfully. And she says, although I could have proceeded with the extraction, I chose to begin with a thorough consultation. During the assessment, I became concerned with the lesion appearing suspicious, and I was potentially may have been potentially outside the scope of my practice. Rather than proceed, I referred her to a doctor for further investigation. A week later, she returned with a bandage on her nose and confirmed that the lesion was indeed a basal cell carcinoma. She was incredibly grateful that I had recognized the warning signs and referred her appropriately. What stood out most for me was that even though I could have tampered with it, I realized that maybe this was outside of my scope of practice. That experience reinforced several important lessons to me. In that moment, I did not prioritize a KPI or a sale. I prioritize the client's well-being. I use my professional judgment, remaining ethical and staying within the scope of practice, my own scope of practice. In doing so, I not only protected the client, but I also built genuine trust and a lasting relationship. How powerful is that? That was
It's
really,
very
really
good.
good.
It's amazing.
And then she says, to me, the true importance of being honest, authentic, ethical, and remaining with your is the foundations of a good practitioner. And yeah, we solve problems, and sometimes we can hit something that's really we shouldn't be touching. And I think bringing attention to that possibility, I thought was very powerful, and I really appreciated the opportunity to share that with everybody. So thank you, ladies, for your wonderful time and for sharing your knowledge and experience. And it's always a pleasure to share with you. We do have the nursing one next. And then I think the one after, we've got one for nurses, which is going to be very, very good. And then the July one is upgrading the consultation procedure for stronger risk management, regulatory compliance, and enhancing treatment outcomes. The consultation has now evolved to a totally different document to what it used to be. So that's going to be a nice one we can do. I think we'll be doing that in July. So thank
That's
you.
a good one.
Yeah, it's a very good one. Thank you for your time, and for everyone, if you like and subscribe to our YouTube channel, you'll be get the notification bell so that we can let you know that you of the next session. Thank you so much, and let's move and be and really honor our profession in a way that is relevant to our clients' needs and important strategies that will help with the success and the success of the clinic from a business perspective as well. So
Thank you, Tina.
Thank you. Bye-bye.